All right, so we're here with Dr. Matt Calkins and Dr. Avinash Cherian. I wanted to talk with them because they're at different points of their FAM journey. And so we're on day 3 of our advanced surgical course, and I've got 2 guys here. So you are scheduled to do these cases at our next course, right? So you're going to be coming in September to be an operator. And then you came to this course as an observer.
Correct.
So he's part of our Full Arch Masters Fellowship.
Yeah.
You're now getting your first introduction to Full Arch Masters. So I'll start with you, Matt. What has been your overall experience this weekend?
It's been a great experience. I've really enjoyed it. Yeah, just like level of quality of the mentors who are over the shoulder, providing just direction has been really great.
Right.
I felt like the lectures were excellent the first day, and the patients, you can tell, these are tricky, difficult cases. And there was one that we had yesterday where Dr. Sam, it seemed like every single site was just tricky.
Everything had a nuance of difficulty.
Yeah, the bone was so thin, and what I just loved about him is that he kept going at it. And he's like, we're gonna get this. And it was just really neat to see his, kind of his mindset too. So there's a lot more you get out of this course than just kind of the technique. And
right.
Yeah, it's been really great.
So a lot of great things.
It's been awesome.
Yeah. All right, Dr. Cherian, so you have the perspective now of having watched these cases from, chairside. Mm-hmm. But now, in September, you're going to be doing them. How does that feel, and how do you feel about that?
It's good. I feel a lot more confident because the first day it was the first day you're thinking, how's it going to be, and what kind of cases you're going to do. But when you actually see the level of complexity that the mentors are doing, and they never give up attitude, because when you're training somebody, sometimes the trainee doesn't do what you're supposed to do, and that's what the trainee is doing.
Right.
It doesn't go right the first time, but the second time, just like that case I saw,
that was so cool.
Just not stopping until he gets it spot on.
Get the result.
So, not an ideal situation, but how to fix it even though there's a problem. So that was a great learning experience. That's what just brings out the quality of the mentoring, and if everything was simple and straightforward, what are you going to learn?
Right.
That's not the real world case. So
right.
I love that.
And sometimes easy cases, quote unquote easy cases, become nightmare cases just like that.
Yeah.
And you don't see it coming, and all of a sudden you're knee deep in it, and you don't know how to fix it. Mm-hmm. So this course gives you some of the skills that you will need to rescue your own cases, and then to revise them later if you need to.
If need be.
Right.
Yeah, absolutely.
So Dr. Matt, like I said, this is your first kind of footstep into the FAM world. What are your impressions? We know how special we are, but what are your impressions of the culture and the camaraderie and kind of the brotherhood and sisterhood that you see?
So honestly, I've kind of seen it from afar for a few years now. I've seen you guys get pretty big, and I've just kind of done other pathways, along the way on my own. But I've always kind of had a respect for the program you guys provide, and I don't know, being here myself, I've had a really good experience, and I've just had a good feeling from the people I've spoke to, from a level of care of what you guys, you just really, you're passionate about it, And I think the biggest thing that you get with the FAM family is really, it's the networking.
100%.
It's the friendships that you create, and kind of being on the group chat and being able to see real problems that are happening with these docs, or new implants that are coming out, and conversations we were having the other day. It's just amazing to have that support. And I kind of look back now and I'm like, I kind of wish I would have came a little sooner, to be honest, But
I hear it a lot.
Yeah, but I'm happy now that I'm here. So
right.
Ryan, thanks for having me. This has been a really great journey.
Like you said, you and I have chatted over the years, and when you came up and introduced yourself, I was like, wait, I already know you.
Yeah,
you don't have to introduce yourself. But then I realized we never actually met in person. But that just shows you that so much of our lives are spent virtually, and we're on our phones, we're on our computers, we're on TV, and blah blah blah, and we rarely get a chance now, especially in a crazy post-COVID world, to actually meet and be together. And being together is really, really important. And education can be done virtually, but nothing compares to this. Being chairside, being in the lecture hall, practicing yourself, working with real patients, working with the mentors. There's nothing that can compare to that. And so
I agree.
I take a lot of pride in this course, because these courses are hard to find, and there's nothing like this, exactly like this.
Right.
you're more than welcome as a family member, as a brother. And so looking forward to seeing a lot more in person and live stuff. So
we'll be back. Yeah, we'll be seeing each other again shortly.
I like it. So just spending a couple of minutes with two different fam docs at different points of their journey. Dr. Cherian will be joining us in September for our next edition, doing live cases. Who knows? Maybe Dr. Matt will be joining him. You never know. Lots of fun, lots of education, lots of work going on, but it's all in the family, right?
Yeah.
So thanks, guys. Get back into the case. It's exciting stuff. I'll take the mic. Have a good rest of the day. All right, so different docs at different points of their career, different points of their fam journey, but all here in Cincinnati, learning, having fun, challenging themselves, wearing their bodies out, wearing their minds out, and going home satisfied. So that's what Full Arch Masters is all about.